Today is our 2028th day of continuous webinar. Thank you all the participants for joining with us. And now we'll start with a silent prayer. Good evening and welcome everyone. Today is our 2028th day of continuous webinar. Today's our guest is Dr. ARPITA Chatterjee. Dr. ARPITA, have you joined? I think doctor has not yet joined. She's MD in homeopathy and PhD scholar. She's working as a HOD and professor in the Department of Pathology and Microbiology in Sumandeep Medical College, Gujarat. Guest lecturer at prestigious Psychology Department, Sigma University, Vadodara, and Chief Physician of Healing Center, Gujarat. Founder of NGO World Healing Society Foundation. And she got many awards. Face of the Year Woman Award in 2023, Social Work and Homeopathy Awards, and Speaker of Scientific Committee Society, Best Teacher Award from Parul University, Speaker of Scientific Committee in Asia, and she has presented many papers. I'm welcoming Dr. ARPITA Chatterjee to the IFPH forum. Dr. ARPITA Chatterjee, have you joined with any another name? I don't think. Dr. ARPITA Chatterjee has joined. Doctor, you are welcome. I made you as a co-host. Dr. ARPITA?
Hello.
Yes. I have already introduced you.
Are you able to hear me out, ma'am?
Yes.
Should I start the session then?
Yes. You can start.
Namaste to all the viewers. All right, okay. No problem. I got a little late while joining. Namaste to everybody. So today my topic is regarding the phases of disease in acute cases and the homeopathic prescription regarding it. So we all know about the when it comes to acute diseases, there are always phase, like the disease starts with a earlier stage, then we have the peak when the symptoms are very prominent, and then we have a stage where the symptoms either decline, there is a recovery after that, or it could lead to the decline of the patient, where the patient doesn't recover anymore. It could lead to either complication, and the last one, it could lead to death. So if you understand, this is the phase of a disease. Now when Dr. Henneman was talking about the phase of the disease, that was in 200 years back, and during that point of time there was no microscopes, there was no pathology that developed, then people were not even knowing about microorganisms, let alone virus or anything like that, parasites. So in spite of all this, Dr. Henneman came through an observation. So he observed things, and according to that observation, he said that when we are talking about any acute diseases, so diseases we have to take into consideration the symptoms, the present current symptoms which are present, and those should be the keynote symptoms for us, guiding us to this medicine. And whatever medicine comes, that should be based on the totality of symptoms. Now he was right when he said this, because he talked about the symptoms which were perceptible, which could be seen by us, and those symptoms. And if you see in any acute case, say for example we start with coryza. So when we talk about coryza, so coryza, we are trying to understand coryza from a conventional medicine way. So what is coryza? Coryza is when you have cough, cold, with running nose and all, which could be due to some infection, viral or bacterial, due to some, and the host should be susceptible to it. And for being susceptible, it means the person should be susceptible to the weather condition, to the immunity of the person should be less. All this together helps to make the patient vulnerable to the infection. So as when the person is vulnerable, definitely the person will get infection from a virus or from the bacteria which is present in the environment. So, and after that, the patient will show symptoms. So when we talk about any disease condition, we have to understand that for a disease to develop, there has to be a disease cycle as per the modern understanding of disease, and also there has to be a chain of infection, because unless that chain is there, unless that possibility of getting infected is there, infection is there, a person cannot get infected. Once a person gets infected, then a series of symptoms and signs and symptoms are seen on the patient's body, which we clinically verify by whatever is being observed and what is being diagnosed. All right, it could be through reports or it could be also through our clinical observations. So in that format, if we understand, so this is the modern understanding, and I would like to share my PPT. So just 1 minute, let me share my PPT. So we'll start with that. Yeah.
Yeah.
Are you able to see the?
Yes. Introduction. Acute disease are rapid.
Can you hear me out, madam?
Yes.
Okay, fine. So now, so this is my topic, acute diseases. So what is acute disease? It is rapid in onset and so for shorter duration. And madam, if I share whole, can you
What?
still hear me out?
Yes.
If I'm trying to see it right now.
No, not your face. Only the screen. Your sound
Only the
is.
screen, but you can.
Yeah.
All right, you are able to hear me out, right?
Yes.
All right, no problem, madam. Is it fine now? Yeah. Okay, fine.
Yeah.
So, as according to the homeopathic science, we always take totality in, for our case taking and for the medicine prescription. Now, what I have tried to do here is to try and understand how is the modern conventional science understanding acute diseases and how we can integrate the two and see how beautifully homeopathy can help in acute cases. The problem is many a times we are very confident when it comes to chronic diseases. When it comes to acute cases, we become a little our confidence regarding taking acute cases becomes a little unstable, or we are not very confident about it. So if you understand, the conceptual understanding is there, and if we know how to go about with acute diseases, I think we would be able to do much better for the patients and also for the homeopathy at a large. Now, what is acute versus chronic? So when it comes to acute diseases, as we understand, the onset would be sudden. It would be of shorter duration. It can lead to either recovery or it can lead to, unexpected. If it doesn't result in recovery, it can either go into complication or the patient can die. In chronic, when a disease cannot cannot be controlled, or is not being or the patient does not recover from it, it goes into the chronic long standing disease condition which requires management. So what are the examples of acute diseases? Like we have like fever, coryza, diarrhea, abscess,
Doctor,
urticaria,
are you
etc.
moving the slides or you're now? I am seeing the second slide.
Yeah, I'm moving the slides, ma'am. Yeah, I'm moving the slides.
But
Yeah. Okay. Now going forward, phases of acute diseases. Yes. I'm moving the slides. Okay, ma'am.
no. But
Can you
now I am seeing the first slide. You are talking about the phases of acute disease, means the fourth slide, right? You
the
need
third slide? Yeah.
third slide. So please press that.
Okay. Can you see the phases of the acute diseases?
No, only the
First.
introduction slide.
Okay. Can you see right now, ma'am?
Yeah. Now
All right.
only.
So I'll keep it like this only, because when I'm expanding the screen, it's not being visible. All right. Can you see it right now? Currently, it's visible, ma'am. Phases of acute diseases.
Visible.
Yeah. So as this is as per the conventional medicine, what is phases of acute disease? So phases of acute disease starts with the first phase is prodromal phase, then invasion phase, then the peak phase or the fastigium. The fourth stage is decline phase, and the fifth is convulsions. Now, what do we understand with this? When I say prodromal phase is the initial phase, or also known as the incubation phase, when the infection gets inside the body of a susceptible host. Now, the word susceptible is very important here. In other words, I have to talk in the words of the conventional side, it is the receptive host, the host who can receive it. So, receptive. But when we talk about in homeopathic terms, we talk about the susceptibility, because individual has to be susceptible to a disease for it to occur, to make a person sick. So, in the incubation period, that is the prodromal phase. In that phase, probably you will not see any symptoms. The patient will only become a harbor or reservoir of infection, where the infection will get inside the body of the patient and try to adjust there in that environment. So, following which, now I have a other diagram also, other phase also, to show you how this actually works. So let me share that. First, I'll go through the four stages, and then I'll share the other slide, where you can understand how the bacteria or the virus, what do they do when they enter into the body of the human being. So that is the prodromal phase. The second phase is the invasion phase. So in the invasion phase, what happens is that now after the incubation period, when the bacteria has colonized, multiplied, had growth in the body, now it tries to invade and reach to the areas, to the places where it can, uh, reach, or where it can get a better condition to survive. So that's the invasion phase of the infection, when it tries to get deeper into the tissues and the organs. After that comes the peak phase or the fastigium phase. Here is the phase where we get to actually see the sign and symptoms. So before that, in the invasion phase, you might see the patient might have a little vague symptoms of, not feeling well, appetite less. There would be changes in the generalities, like the sleep would be disturbed, will not feel better. These are the symptoms when the patient talks about. Now, if you see in the conventional medicine, they do not have any medication for this phase. Because in this phase, when you go for a report also, the reports will come, diagnosis will, if it is based on the reports, then the reports will show false negative reports will be there. So even if a person is suffering from malaria, the malaria reports will be false. If a person is suffering from dengue, the dengue will come false negative. So that is the phase during which the patient will not actually will feel it. It will be more subjective than being objective. Now the third phase is the fastigium phase, where the peak phase, where we actually get to see the sign and symptoms of the disease. And here is the stage where we basically see a patient manifesting the disease condition. And now during this phase, if we go for a report for the diagnostic test, we will get some kind of abnormalities, and we would be able to detect the problem. So this is the third stage. So by the time the patient actually shows the sign and symptoms, it's in the third phase of the disease of acute, where the organism has actually invaded the body and has reached to a point where it is able to now show the sign and symptoms. Now, what do we basically understand by sign and symptoms? It's a basic defense mechanism of the body. Now the host have actually recognized that there is something which is not mine, it is foreign, it has invaded my body due to certain condition of the person, which we call as the susceptibility, because of the patient's constitution, temperamental disposition, the environment, the food conditions, the various multifactorial reasons are there which can lead the person become susceptible to. When a person is susceptible to bacterial or viral infection, what happens is that once it enters the body, it somehow invades the immune system of our body. When it enters it bypasses that immune recognition, and when our recognition fails to, when our body fails to recognize it, that is the time when these are the phases where the organism actually gets to grow, adapt, and understand the body in which it enters. In the third stage, the body now recognizes when the organism, say for example, if it's a gram positive or gram negative bacteria, they start releasing endotoxin, exotoxins. Now, so when these things are being released, that is the point where the body recognizes that now this is not something which was in my body. And then it, once it starts to recognize it, then the defense mechanism is switched on, where we see infiltration by the neutrophils, followed by the T cells, B cells, meaning antibodies, then macrophages, phagocytosis, and all this thing, natural killer cells, all these cells comes into play, and because of which then we get to see the sign and symptoms. So this is the third stage, where it is also very much perceptible, subjective as well as objective. Now after this phase, there is a decline phase. Now in decline phase, what happens? Now here we are talking about, when we talk about the phase of acute disease, here they are talking about a natural disease process. So when a natural infection occurs, the fourth stage is the decline phase, where the body has tried to control the growth and the effect of the organism to the point that now the organism stops growing and it starts to decrease in the number. As a result of it, the sign and symptoms of the body also changes, and following which the body starts to go into the process of healing, which is known as the fifth phase is convalescence, where the body starts to heal itself from, and we have a mechanism. See, whenever we in pathology, because I teach pathology, so whenever we are teaching pathology, with that we always teach the healing. So the other part of pathology followed by the inflammation is the healing process. So we have to understand one thing: a person who is deceased is basically the one in whom the inflammation part is either too high, or the healing process is quite slow or not at par with the inflammation. So whenever the body is, getting infected or being harmed by something from the outside, the body gives reaction to it, which is a defense mechanism to it, which we call as inflammation, and following which simultaneously the healing process of should also start taking place. Meaning, if there are chemicals which are released to destroy the bacteria, say for example by increasing the temperature of the body, simultaneously there should be antipyretics which are being released from our body itself to control the temperature, which happens simultaneously. It's like after a few days the body starts to go into the phase of recovery. So this is a normal process of an acute disease if the person is going towards getting cured or recovered. A natural acute disease goes through this process. If the convention phase, after the fourth period, if the body doesn't go into the convulsions in the recovery zone, then it can go into the complication phase, where the disease can become a chronic disease, or after the peak stage, the patient can either go into the decline phase, where the body has been taken over by the bacteria. So this is the phase of the disease. Now, when we try to understand this in the host, we should also understand what happens when the bacteria or the virus enters into our body. So what does the modern concept talks about? So here they're talking about bacteria. So when the bacteria, fungi or parasite, it enters in our body, it tries to adapt to the new host. Now this is what I was talking about. So when they enter into our body, so they also try to understand our body, and that is the time which is known as the incubation period, where you really do not get any sign and symptoms, but the body is trying to adapt to the situation, to the host, to the environment, and getting to know it. But during that time, that is this here, you can see in the prodromal phase and the invasion phase, these are the two phases where the organism is actually adapting to our environment. It's trying to be not very aggressive, but trying to get an idea of what the body is like or what the host is like. And during these two phases, again in the initial phase, we do not get any sign and symptoms. But in the second phase, that is in the phase of invasion, where the body, where the infection goes and enters into the body, tissues and organs and other cells, this is the time when there would be very minute changes in the biochemistry of the body, very light, minute changes which will not be perceptible through the diagnostic test which we have currently. All right. So in that case, the patient might come with certain vague symptoms which we call, like, not feeling well. There's a feeling of not having good appetite. The sleep cycle might get disturbed. Appetite is not proper. Thirst might increase or decrease. Appetite might increase or decrease. There would be more lethargy, uh, some kind of brain fog. The patient might feel some tightness or stiffness in the areas. So these are the symptoms. So we do have medicines for those phases. So that's why you see it's very important to understand the signs and symptoms. Now, following the adaptation of an organism to the new host, then comes is the epidemic or the pathogenic stage, where the number of organism increases or the number of cases increases. So it can lead to when Dr. Henneman also talked about individual acute cases or sporadic acute cases, and endemic acute cases, pandemic acute cases. So what he was talking about, an acute cases can either restrict itself to a individual, or it can spread to a locality, to an area, to a more involving much larger population. That can also happen. So here again we can see that a pathogen, when it enters into the body, it can either remain in that individual, or it may also affect the community. Then after that, either it could be endemic or pandemic stage. And lastly, when the last stage is fully adaptive stage, where the pathogen become non-pathogenic, potentially beneficial, or stably integrated. Now this is very, when I was trying to understand this thing, this became very intriguing for me, because Dr. Henneman talked about latent phase of disease. So if you see in miasm also, he's talking about latent miasm. So I'm not trying to say that infection is miasm. No, do not take me that way. It is basically, infection is not miasm. That's a wrong understanding of it. But what I understand is that when Dr. Henneman talked about miasm, he talked about a latent phase. When he talked about acute diseases, when he talked about chronic disease, he always talked about a phase of latency, dormant state. Now, if you see in the organisms also, so in the organism, like bacteria, fungi, parasite, they also undergo a stage of adaptation where they become non-pathogenic for a temporary time being. So they become more of an opportunist. Whenever the opportunity arises, they again can develop into a more potent form and can affect us. So this is one thing which was very intriguing for me to understand. And if you see, there are certain diseases, let's say for example tuberculosis. If you see tuberculosis, although it's a bacterial infection, but it is one of the oldest infection in the world which has been documented in the history. So if you see leprosy, so all these diseases, they have a history where the organism has adapted to the host. And to an extent that even if you see the pathology of Mycobacterium tuberculosis or Mycobacterium lepra, the thing is they do not produce any type of antigen antibody reaction. It is in Mycobacterium tuberculosis, it is the type 4 delayed hypersensitivity reaction. So body gives a hypersensitivity reaction based on the glycolipid which is present on the wall of the organism. The organism as such remains dormant in the body and can remain like that for years. Now this is very interesting. So if you see any organism, so even during the time of COVID also, because our body was not adapted to that virus corona, our body in the history of human history, if you see, we have been carrying we have been used to the corona family, the virus, but this COVID-19 was a new variety, a new strain to which our body was not used to. So for that reason we were reacting. So we were try so that's why the COVID-19 was able to affect us at that faster stage, and we were not able to control it. The moment, if you see in the phase 1 and in the phase 2 of COVID-19, the body's reaction changed, and we were able to contain it. The body was able to contain it. So that's the interesting fact when it comes to the understanding of diseases in acute cases. Now we also have to understand another thing, that is the stage of development of diseases. So that's what I was talking about. So whenever the infection takes place, now if you can see this cycle, the infection comes and invade the body, causes colonization, then it leads to production and growth, followed by symptoms development. After the symptoms have developed, two things can happen. Either the symptoms can disseminate and go into the second inoculation, meaning it can involve many other people, like the person can become a carrier and can infect others, or the symptoms can lead to other secondary manifestation in the other parts of the body. It can disseminate into the vital organs and can cause some kind. The other thing could be, after development of the symptoms, it could either remain dormant, meaning that either the body has already taken care of that bacteria and has subsided it, or had killed it, or had removed it from the system, or else if it remains inside the body, the organism can become dormant for some time, and later on it can again reinfect the body of the same primary host, disseminate, again incubate, attach itself, go into the deeper tissues, and then start the infection again. So this is again a complete cycle of infection. The infection can get in the body, grow, develop symptom. Either it can become dormant or it can be cured, recovered from it completely. In the dormant phase, the person actually carries the infection inside, but it is latent, it is dormant. So the patient will not show any sign and symptom unless and until there is some kind of environment provided to it. Once that environment again comes, the organism will grow, start to penetrate deep again and affect the host, or else the disease will go deeper into the body, destroy the person, or can also affect other people by making the host a carrier and increasing the infection through contamination. So that could be again a development. So this is a disease cycle, normal understanding of disease as such, about the modern conceptual understanding of it. So what is say about the modern disease cycle? So infection, incubation, symptom development, peak, and recovery. Now if we understand this, it helps us in giving the homeopathic prescription and also the timing. This is very important for us. For any homeopathic medicine, see, we have to take into consideration the keynote symptoms. Not only the keynote symptoms, we have to also take into consideration the modalities, concomitant associated symptoms, the temperaments, the thermals of the patient, the thirst. All these things help us to prescribe a medicine. So in order to, if you see, we have in Homeopathic Materia Vedica very clearly mentioned about the modalities, about the time modalities. That's very interesting, and we might sometimes think, will this really help us? But if you see the modern disease cycle, you will really get to understand that when we are talking about the disease cycle also, the infection, incubation, symptom development, peak and recovery, here the timing again matters. So again, as such, medicines which are similar, which has a similar time modality, which is in the similar phase of the disease, which has similar sign and symptoms, which can be perceived through the sign and symptoms, if we give the medicine, it will definitely act. So we have to understand this, not only understand, but have to also be very much faithful that this works, and this really works. Only thing is, we are unable to correlate it with modern science, and therefore we always find or try to doubt ourselves. The chain of reaction, the chain of infection, how the chain of infection happens, like I said, agent, like means the host, it becomes the reservoir from where the infection then goes out, then there is transmission, portal of entry, host, breaking chain. So this is about how to prevent and cure as far as the allopathic science is concerned. All right. Now here, if you understand the chain of infection, somehow this makes me wonder that Dr. Henneman talked about the various factors, multifactorial factors which are responsible for an infection to occur. Remember, so acute diseases are due to some kind of exciting causes or exciting factors, and the chronic diseases are due to fundamental. Now, if you understand this, exciting causes. Now, if you see the chain of reaction, see, this will be very interesting for you. Chain of infection. So, how does an infection happens, or how does an acute disease occur? We always talk about the multiple factors. Now, if you see, first there has to be an infectious agent. Of course, there has to be an infectious agents like bacteria, fungi, parasite, or prions, which should carry that infectious agent first. All right. Then second, there has to be some kind of reservoir, meaning there has to be certain amount of that infection present somewhere, meaning the environment, people, water, food, soil, somewhere it has to be present, right? Following which, there has to be a susceptible host as well. Now, a host who is having immune deficiency, probably, maybe because of the age of the patient is getting affected due to that bacteria or virus. Say, for example, chickenpox, it mostly affects the children because of the susceptibility of the host. So, immune deficiency, diabetes, burns, surgery, age. So, many factors that determine the host susceptibility. Then there has to be some portal of entry, so it has to enter from some place. So if you see, it has to enter means either it should be from the skin, from the respiratory organ, from the digestive system, from the mucus, from somewhere it has to enter. And lastly, there has to be a mode of transmission through contact, through droplets, from airborne, and there has to be some exit also from blood, secretion, excretion, skin, etc. So if you see this, the very important factor is, this is something which the modern conventional science is talking about. But if you see, Dr. Henneman had talked about this in his chronic diseases, in his book. He has already talked about it, and he has talked about the cholera. When cholera was, it used to be endemic at one point of time, where many people used to die due to cholera. And if you see the perception of that man, when he talked about cholera, he talked about all of these things. There is a line I still remember when I was doing my MD. In that book, it was written, what are cholera? Cholera is he wrote, see, something which he wrote 200 years back. He wrote something like, invisible animated being which can spread from a crowded, mashy area. Now, this was very interesting. If you read the entire, so I remember a few lines of it. So next time, if I get some time, I'll somewhere even show that page to everybody of you. But yes, interesting. And if we read the microbiology book, it sounds similar. 200 years back and 200 years after, the same thing. Animated being. Imagine a person talking about something which he can't even see, he can't even understand, or maybe in his time he couldn't even there was no such concept about microorganism, and he's talking about something like animated being. The word is animated, invisible, you know. So yes, he was right. And he also talked about there has to be a portal of entry, a mode of transmission, infectious agent, a susceptible host. He had talked about everything, a reservoir, like he said about mashy crowded area. See, so he was so right. He has talked about everything. Only thing is today we are giving those headings. So once we have understood this, definitely that man was a genius. So now coming to the phase of disease. So here in the phase that is the prodromal, let's come to the homeopathic part then. So what to do when the patient comes to us with that prodromal phase, initial phase, when the infection has just entered and the patient is under that incubation period, the organism is still not very prominent, signs and symptoms have not yet developed. So the symptoms, the patient will come with mild symptoms like restlessness and not feeling well, appetite reduced or something like that. So in that case, you can have remedies like we have aconite when there is a sudden onset, belladonna, early congestion, you know. So we can go for those kind of medicine during the prodromal phase. Then comes to the invasion part. When it invasion means the body is getting invaded by the infection. So now the symptoms have become a little clear. They have started developing, and you can see developed symptoms. So definitely according to that, now you can try to prescribe medicine. Now here the symptoms would be more like bryonia. When the description of bryonia, if you read, it is a slow, gradual developing disease. Yeah. So during the invasion phase, because still the body has not aggressively identified the organism or the host or the pathogen, so definitely the reaction will be a little mild, and then again the symptoms are there, but it's not very aggressive and all. So in this phase, the remedies would be more like bryonia, dryness, thirst, slow developing. Phenophos again in the early inflammation stages. So, and then again, the important part is, if you see the medicines we have in boric, we have, if you go towards the back, so you can see the remedies that follows well. Very interestingly, if you see the medicines that follows well, they also follow well as per the phase of the disease. So if you see the after aconite, you can give bryonia, and if you see the aconite is sudden onset of a disease condition, which is always in the early, very very early phase of the disease we give, and followed by the bryonia, which is like slow, gradually developing. There is disease condition where there are signs and symptoms, but they are very slowly, gradually developing. So see, the beauty of homeopathy is that not only do we can control the disease. So in the invasion phase, if you remember, what is happening inside the body is that here the growth and the colonization of the bacteria or the virus is happening, meaning the body is being the susceptible host is providing an environment where the bacteria and the virus or the fungi or the parasite can grow. Now in this phase, if you can give medicine, what does our medicine do? The medicine will help to make the environment unbearable for the bacteria or the virus to grow. Once it can happen, if we can do that, what will happen is that we can cut short the acute phase of the disease which was supposed to run for 7 days, the coryza which runs for 7 days on its own, we can cut it short to 3 days or 4 days with the help of our medicines. So that is the beauty which can be used. Now the third phase is the fastigium phase. In this phase, where you see the severity of the disease is at its peak, when the signs and symptoms are full-fledged, it is very much visible on going through any type of test. Also, we can see the result. We can see the diagnostic test coming positive, all these things. So here, if you see like belladonna, high grade fever, congestion, there are mental and physical symptoms very prominent. Rust strokes, very restless, unable to sleep, keeps moving here and there. Although the body still has strength to move around. It's not like arsenic yet, where the body is unable to move, only the mind is running. Here the rust strokes. Patient is moving around, feeling restless because the body is trying to fight it on. And again, there is a beautiful relation between belladonna and rust strokes. So belladonna is followed by rust strokes. So this is the beauty of homeopathy. If you see the follows well medicine, these are always as per the phase. What I have observed in my practice also, especially when it comes to fever and in case of cold and coryza and cough, I've seen that as per the phase of the disease, we are directed towards the medicines which actually follows well or which are complementary in nature. So I have seen it in my practice, and that's why when it comes to the acute cases, we need to reevaluate and reanalyze the case as per the phase of the disease. So in acute cases, whenever you are giving medicine, this is my own understanding, and with my own practice, what I understood is that whenever we are giving medicine to the patient, we have to make sure that we are continuously monitoring the patient, either asking them to give us an update every 24 hours, or after every depending on the condition of the disease. If it's a fever, so normally what I do is I take an update of my patient after every 3 to 4 hours or 6 hours. So get to understand what the phase of the disease is, like if the thirst has increased or decreased, the phase of the disease, the phase of the fever. The fever is in the cold stage, heat stage, or the sweat stage. So accordingly, we can give the medicines, prescribe the medicine. So the medicine, if we prescribe at that point of time, it helps the medicine to give action and also the body to recover. So these are understanding. Then comes is the decline phase, where the patient, the symptoms have reduced, and here you can see medicines like pulsatilla, gelsemium. These are the medicines which gives good reaction, or good they help the body to get better with especially if there is a decline in the symptoms and the patient is getting better. In gelsemium, again, there is weakness. In arsenic, again, patient becomes a little weak, unable to move around, and all these things are there. So gelsemium, pulsatilla. Again, we have to remember one thing: it all depends upon the individualization of the case and on the sign and symptoms, the keynote symptoms of the case, the modalities, the concomitant. These things are to be taken into consideration whenever we are taking acute cases. Then, of course, the convalescence phase, the recovery stage. If you see, I have seen many, stalwarts, or many a time after the recovery from fever, or especially from malaria and all, I have seen people prescribing China sulfur. So this is basically to reactivate or give them the ability to recover and restore the vitality. All right, and it really works. You can try them out, and there are many medicines. These are only a few which I'm talking about. China for debility, for sulfur for reactivation, to give reaction. And sometimes I've also observed, in many cases where the patient have to take antibiotic. In that cases, I have observed that when even the antibiotics are in most of the cases today, if you see the antibiotic, people have become resistant to antibiotics. So in many cases, what I have observed is that when we give some anti-miasmatic dose, especially sulfur, I have observed, it's my own practical observation, that when we give that, it somehow helps the patient to give reaction to the antibiotics, and they become, they accept the medicine, and the body starts to go into the phase of recovery. So again, wherever, see, it's not about, when we talk about acute cases, we are not only talking about the cases which comes to us, even the cases which do not comes to us, which goes to allopathic or the conventional medicine. If there also you can, if there you do not see the kind of result that is to be seen, or that is to be perceived after giving antibiotics or antipyretics. If something like that happens, in that case, again, if we give our medication, depending on the sign and symptom which is present, it helps us to, it helps the patient to become reactive, and the patient starts to give the compliance, which we call as in modern medicine, they call as the compliance. So sometimes there's non-compliance to the medicine. I have seen compliance of the medicine. I've seen that after giving sulfur 1 dose or 2 dose, the patient started giving good result with the antibiotics as well. So that's again a beauty of our homeopathy. Now I'll just, before coming to the end of this session, which is another, I have 10-20 minutes for that. So I would like to discuss a few uh, disease condition, and there are a few medicines which will just help us to, understand a little bit of it. So if you see the fever, it's a basic understanding. What normally in fever happens is that with every phase, like in fever there is phase, and here I'm just talking about the remnant fever. So in fever also there are different types of fever: remnant, intermittent, tertiary. So depending upon the type of fever, here I'm just talking about the remnant fever. So if there is a fever which comes, suddenly, and then it follows a stable path. So in that case, if you see the phase, if you understand the phase of the disease, so initially when it is sudden, all of a sudden if it happens, so I'm giving a small medicines which you can follow and you can see in your practice, and it will definitely, most of the time it works. So it's like aconite. If you start with aconite, of course the symptoms should match. So that will be then followed by belladonna, followed by bryonia, and sometimes I've also seen that bryonia and rustrox, they complement each other. So you can even switch. Sometimes instead of bryonia, rustrox also works, or the rustrox can be in place of rustrox, the bryonia can work. So depends again on the sign and symptoms. So aconite followed by belladonna, then bryonia, and then again you have the gelsemium. So phase wise the disease. So fever as such, if you see as per the phase of the disease, when it's acute, uh, sudden onset, start with early congestion stage, give aconite, followed by high grade fever, and when the peak, when the sign and symptoms are very prominent, maybe it will go towards belladonna, then followed by bryonia and gelsemium during the recovery phase. So based on the stage of progression, if you see, this is for remnant type of fever. Of course it can go for intermittent or tertiary fever as well, but depends, again you have to take the sign and symptom into consideration. So when you take into consideration, keep a track of the disease, keep the track in the sense the phase of the disease. It helps you to give the medicine on time, reduce the phase of the disease progress, and also give recovery faster. Then after that, second is coryza. So in coryza, see, if you read the book of ENT, very interestingly, it says 7 days. So in the first initial phases, what you have is dryness of the mucous membrane with a little bit of sneezing. That is the first initial stage. If you see, and that is because of some exposure to some cold or exposure to some allergen. This is what is given in ENT books. So yeah, if you see, it's similar to aconite kind of phase. Then of course then there is running nose, starts with nose which are running. Now whatever medicine here I am giving you, these are the medicines which follows wells also. So one thing you have to remember, whatever medicine we give, apart from the phase of the disease, you have to also see that it should follow well, or it should be complementary. We should avoid giving any medicine which antidotes or which is inimical to the earlier medicine which we have already given or the patient was improving from. So this is one thing we have to keep in our minds very clearly. We have to understand before prescribing. All right. So aconite followed by allium cepa, wherein we will in the second and the third day, on during the second and third day of coryza, there is running, watery nose. The patient is sneezing. The water will come out continuously. It's like watery thin. That is allium cepa picture. Then followed by, after third and fourth day, Once the body starts to go into that, from the peak stage, fastigium phase, when it goes to the phase of decline, here the secretion will become whitish, a little thick, and there will be discharge, but it will be less compared to what it was in the first 2 to 3 days. Then here, and from third to 4 days, it will become a little thick. It will be difficult to come. There will be no stoppage of the nose or blockage of the nose, followed by yellow thick mucus which will come out, and then the recovery will take place. On the 5th to the 7th day, the patient will be recovering from all of it. The nose blockage will go, and from the 7th day onwards, the patient will be fine. So if you see the in pulsatilla, again there is blockage of nose with thick yellow pus like secretion. So very similar to what you see in coryza. So this is something which I have given. If you want to use it, you can use it. But again, as I said, each case differs. Each patient differs. Now in diarrhea, you can see arsenic alk, podophyllum, vereta valve. Now it again depends on the intensity and character. If you see the arsenic alk here, that is because of food poisoning or any type of poison. Poisoning meaning any type of food which is not digestible for the body, and because of some food which they have taken from outside, some stale food or something like that, would lead to diarrhea. So in that case, we can go for arsenic alk. In podophyllum, the patient will pass, excessive stool, like you see. In initial phase of in arsenic, the stool is less in quantity, but there is a little bit of pain and cramps, and followed by stool which is less, not much. But in podophyllum phase, it is painless and continuous, but after that, in the varietral map, if you see, it is little less again, but on a strength, vitality would be more, would be less as compared to what it was in arsenic. So this is what you can again see: arsenic followed by podophyllum, followed by varietral map. Again, it depends. Hello.
Doctor, you can proceed. You have 4 minutes more.
Hello.
You can proceed. There is
Yeah. Then we have the other is abscess, and then in abscess you have like in abscess, it's very I mean, you might have heard many of our mathematical teachers talking about belladonna, hepar silicia, and in my own practice I have seen, if you give belladonna in the initial process when it is red inflamed, of course it will lead to heparsal. The symptoms will lead you to heparsal. What I've seen is, if you give in the initial phase belladonna, within 1 or 2 days, like 24 hours, the symptoms will become similar to heparsal, followed by, sometimes you might, with heparsal only it can get resolved, or sometimes we might need silicia for healing and for
Doctor, you have only 2 minutes more.
Yes, madam. Just I'm done. Similarly, we have urticaria. For urticaria, you have Apis mellifica, urtica urens, Rustrox, based on itching and all. So, as far as modern medicine and homeopathy is concerned, we have to make sure that integrating the two things, understanding the pathogenesis, the phase of the diseases, and the exciting factors, the positive factor. If we can understand it very well, then prescribing medicine based on the medicinal relationship and their pathogenesis and their level of penetration, becomes easier for us to prescribe. So with this, I would like to say thanks to everybody for giving me an opportunity to come in front of you and share my PPT. Thank you so much.
Thank you so much, Dr. Arpita. You have done a very wonderful job, because I explained everything about the cases of acute diseases, even the homeopathic management. I'm inviting Dr. Ram Parveshwar sir for giving vote of thanks to Dr. Arpita. Sir, we have only 1 minute.
Thank you, Anjani. And
Thank you.
congratulations, Dr. Arpita. Very good.
Thank you, sir.
Excellent session. Describe the acute disease. Acute disease, really acute disease. So acute disease, sudden attack the symptom without medicine, expel the symptom. Acute disease. So very, very thanks, Dr. Pita Chatterjee, behalf of IFPH, whole team. Thank you. Again,
Thank you, sir.
presentation. Thank you.
Thank you, sir. Thank you for giving me that opportunity. Thank you, ma'am. Thank you, sir. It's always a pleasure.
Dr. Arpita. Thank you, Dr. Ramparvesh. And thank you all the participants. Good night. Now we are moving to the Malayalam session. I am inviting Dr. Manoj for moderating the Malayalam session. Dr. Manoj, you are welcome.